recording. Awesome. So for anyone who doesn't know me, I'm Lauren. I'm one of the co-chairs of the Student and New Professional Special Interest Group as part of the APTA. We've been starting these webinars just as an opportunity for people to learn a little bit more about oncology or specialization, or how to enter the field of specialization within oncology. So today we have three very special guests helping us out with regards to how to navigate a new career in oncology and just understanding how to learn a little bit more about the population, maybe how to enter the field in general. So I'm super happy that they're here with us today. Just one announcement. Next week, we're having another webinar that should be really interesting. It'll be on the 17th at 8 p.m. Eastern Time, 5 p.m. Pacific Time with Adam Matichak regarding bone marrow transplant and hematology oncology. So that should be super cool. So with us today is Dr. Aspin, Dr. Sharma, and Dr. Tess. So if you guys would please just introduce yourself, tell us a little bit about yourself, as well as how long you've been practicing and what your practice looks like or your day-to-day practice looks like today.
Okay, I can start. I'm Sophia. I'm a physical therapist. I'm also a certified lymphedema therapist, and I'm also Revital certified through Rush Physical Therapy. So I started practicing PT in 2020, but I didn't get into oncology rehab until about 2022. Um, and I'm from, like, I work in Chicago. I live out in the suburbs, and yeah.
Right, I guess I can go next. Hi, everyone. My name is Akanksha Sharma. I'm here in Dallas area. If you are here, please let me know. I'll be happy to hang out with you guys. I started with oncology. I was introduced to oncology rehab in 2009 when I was introduced in one of the my internships. And I kind of drifted away, didn't get a job and what I wanted and all of that. So I worked in SNFs, outpatients, and then I worked some of the oncology rehab, but I got back into it about 3 years ago now, which is crazy. I got into a residency program at Baylor Scott and White Rehab, and I did my residency. I have board certification in oncology, and I also have my CLT certification. And I'm primarily an outpatient.
Yeah, and so my name is Melissa Thess. I am also a PT certified lymphedema therapist. Gosh, I have been a physical therapist. I stopped counting after 20 years, really, really long time. I actually was very lucky to get to be one of the founding members of Revital. So I've been out of clinical practice for about 8.5 years. But most of my clinical time was spent in lymphedema, cancer rehab. Lymphedema was my gateway into cancer rehab, really at a time when it wasn't as prevalent. I ended up, it was not the path I thought I was going to take initially. I was going to be a sports therapist. I was going to marry the star hockey player, and life was going to be great. And it had a different path, and I wouldn't choose it any other way. It was really at a time when outpatient and the world of outpatient had to kind of diversify outside of just kind of that orthopedic base. So I actually had the opportunity to go through lymphedema training and build a program for the company that I was with at the time, and absolutely fell in love with it. Like I said, got introduced to working with people affected by cancer that way, and just completely changed everything about my career for the positive. So was able to go on and build and develop and help to grow different lymphedema and cancer rehab programs along the way. And that was what ultimately kind of set the stage for the Revital piece. And so now I'm actually in a talent role. So I wear several different hats, one of which is kind of helping to introduce students, to connect them with different learning opportunities, help early career, and really anybody at any point in their career, people connect with jobs in oncology within our organization, I feel like I have a lot of these conversations, kind of what are the different resources that are out there to connect you to different pieces within oncology. So yeah, I'm just excited to get to chat with you guys today.
Yeah, and for a little bit of context, it was really exciting to talk to you, Melissa, because over the years, what's happened, which I've only been practicing for 5 years, is that it used to be a lot of people kind of fell into the oncology field by chance. And now something that's really exciting that's happening is students are learning about the field of oncology earlier and getting interested earlier. So I have a lot more questions with regards to how to get into the field of oncology. What can I do to make myself kind of look a little bit more competitive, or like, where do I even start? Right. So I just wanted to have some people here today to maybe help with some of those questions, although I'm sure we could talk for hours about that. So my first question in general, and it's interesting because it sounds like we have a background here. And if all of you want to answer, or one of you wants to answer, that's totally fine. But how did you get into the role of oncology? So for, I know for some of you, you had discussed this. Was there an interest? Was there not an interest? And then what did that journey look like? Anyone can take that question as you will.
Yeah, I was one of the few that fell into oncology rehab. I started in 2020, everything kind of shut down, so it was kind of hard to find something that I was interested in. So I kind of went with what my last rotation was, which was outpatient peds and early intervention. And I was like, oh yeah, that's fine. I like kids. Kids are great. And I started realizing the kids I liked to work with the most were ortho based and like injury pain. So when I saw this job posting for outpatient ortho at Rush PT, it also had lymphedema associated with the role. And I was like, oh, that's kind of interesting. And for a little background, my dad has lymphedema from lymphoma treatment. So I kind of already knew I was like kind of interested in it, but wanted to kind of like wasn't sure if I wanted to treat it, like is it too close to home? But I saw this job and I thought it was really interesting and I needed to get out of peds. So I, kind of went for it and then it snowballed from there. There's a lot of cancer-related lymphedema in the role that I was in, so that was very easy then to make the decision to go into the Revital certification, which is a cancer rehab certification offered through Rush Physical Therapy or Select Medical. So that's kind of how I got into it.
Awesome. And then Dr. Sharma, it sounds like you've had a lot of years of practice, but then within the last 3 years, you were in oncology. So can you tell us a little bit about your journey with that?
Yeah, I accidentally actually fell into oncology rehab because I was supposed to go into neuro rehab internship. That got canceled because the mentors was not available. And I'm like, okay, this is tertiary care. Let's just go. And oh my goodness, it was just such an eye-opening experience that what difference we can make. So here and there, like I would see someone with oncology, but really didn't know what to do. Like, okay, what's the evidence base? So I always wanted to grow more into that, and that kind of led me into. I'm like, okay, let's see what the residency looks like. And at that time there were only 7 programs out there, so I'm like, this must be really competitive. And I got really, really lucky that I got great mentors, and Melissa kind of helped me navigate through all that. It was just amazing experience to go through the residency and then the board certification.
Awesome. And I know, Melissa, you kind of talked about yours with regards to maybe, I think a lot of us go through, we think we're going to be like the sports or the pediatric physical therapist, and then we find ourselves in oncology.
Yeah.
But what was it about oncology, I guess, that like really made it stick for you, like really wanted you to dive more into your specialization?
Yeah, absolutely. I think the initial draw being lymphedema, I was actually in my first job, because I'm in the St. Louis area. I was at the WashU clinic, the outpatient center associated with WashU, and we had 2 amazing lymphedema therapists. And I remember being like, this sounds kind of interesting. You know, we brushed on it in school again, really, really long time ago. So it was very high level, kind of tucked it away, and it kept popping up in different roles that I had early in my career. But honestly, and again, you know, when I chose lymphedema, didn't necessarily realize how much I would be working with people impacted by cancer. And that just quickly became the population within the lymphedema world that I absolutely loved. And I think it was twofold. It was how grateful they are for the work that you do and how the impact that you can have. It was the impact that we were having, right? You know, how much you got to be a part of that quality of life piece. And, you know, when we see in the literature, when we ask patients what's most important to them, it is those pieces that we can affect as therapists, right? But then it was also, and this still drives me today, you know, with all of the work that I do, the number of times that I heard people say, I wish I would have known sooner. And it was with emotions that were, you know, they were kind of tricky to navigate sometimes, right? It was, you know, there was some anger, there was some frustration. And, you know, so I guess I just feel like I'd love to see a world someday where none of us ever have to hear that again, because we're an integrated part of care, we're standard of care, and everybody's at least getting offered the chance to come to rehab from the very time of diagnosis. So it's kind of it's truly the people and the impact.
Yeah, I'm with you. I feel like my student internship, that's when I found out I loved oncology, but the patients were the biggest reason. And I was curious, so I'll ask Dr. Aspin and Dr. Sharma here, what are the most common diagnoses that you see? Because I feel like it's actually starting to change. I think we're starting to see a lot more variety in the outpatient setting, certainly in the inpatient setting, but what are some of the most common diagnoses that you see?
I think I would say for me personally, I think I was seeing a lot of ovarian and like gynecological cancers who developed lower extremity lymphedema after, you know, the pelvic surgeries and radiation and chemotherapy, and then were not referred to rehab at all. And then, you know, a year later, you know, they're having pretty significant stage 3 lymphedema, and then breast cancer, post-mastectomy pain syndrome, breast cancer related lymphedema were big ones for me. Um, that's probably like the most common that I see.
Okay.
In addition to what Sophia said, I think we do get tons of head and neck cancer population too. And it's me and another clinician. It's just two of us who want to see more head and necks and lymphedema, their trismus issues, range of motion restrictions, because that can affect their daily activities of talking, swallowing, everything. So we do see a lot of head and neck in addition to the ones that were mentioned.
And I was just curious for Dr. Aspin and Dr. Sharma, are you guys a part of medical centers or are you in private outpatient settings?
I'm in like, yeah, private outpatient setting.
Okay.
Yeah, we have a partnership with Rush University for the hospital, but the rehab therapists are at like separate clinics within Rush Physical Therapy.
Got it.
So where I'm at, it's a Revital clinic, but we are in hospital-based outpatient setting.
Oh, awesome. Okay, yeah. I ask only because I know sometimes the tricky part of starting out, especially if you have an interest in oncology, is like, where do you get a job? And so I often have students that ask me, you know, either for locations where they take students or should I get an inpatient experience? And so it seems like, especially with the Revital program, a lot more outpatient clinics are growing on the national level. And similar to your guys' point, even here in California, I'm part of a hospital-based system. We are starting to get introduced into the interdisciplinary care team, but there's ebbs and flows. Maybe you guys experience the same thing where sometimes there's prehab and we're on it. We're super proud of that. And then sometimes we get referrals for patients that are a year out of surgery and are really struggling. And I'm not quite sure where the disconnect occurred. But along with that, I was just curious for Dr. Sharma and Dr. Aspin, like what are some of the most common impairments that you see in general? And I know like, you know, fatigue and tightness and those things are kind of some of the most common, but like what do you feel like you see a lot in the patients, and how do you kind of go about those things on just a broad level?
Yeah, I mean, fatigue's a big one. I think people under report it. I think they think, oh, well, I'm going through cancer treatment. I'm going to be tired. It's like, well, it doesn't have to be that way. You know, we can do a lot to make you feel better, and it has less of that global impact. So fatigue is a big one that I see. Impairment wise, like again, depending on where the radiation was, I see a lot of like kind of similar to frozen shoulder from that radiation, or like a plexopathy just from kind of where that was. And then depending again, it's like pelvic radiation. I see the lower extremity lymphedema is huge. And then balance. That's another big one.
Yeah, I kind of see the similar too. Curve is the big one, which we see, and people think, oh, it's a new normal, where it's not. And they kind of fight through and never even report it. And then I have to dig through, hey, are you having some fatigue? Are you taking more naps? So, yes, fatigue is definitely the big one. And in addition, I do see a lot of head and neck, and as I mentioned, so we do see neck range of motion restrictions, shoulder restrictions, trismus, and just overall deconditioning. I also get some of the referrals for neuropathy.
Yeah, neuropathy is very big. And then I don't know about you guys. I will be honest. I had a few, if not more than a few cases that they would come in and I'd have the evaluation and I'd have no idea what was going on, but I did a lot of very good measurements and trying to capture the whole systems. But if maybe you have never have, but if you've had a patient come in that has stumped you, where do you go from there? And I'll speak from experience. Typically, I am very lucky. I have mentors within my setting. And so I immediately will say, I had this crazy evaluation. Can you please help me? But outside of that, right, as I'm seeing the patient and I'm starting to understand whether it's the presentation or pain or fatigue a little bit more, I do go back to evidence and try and look at articles, or I try and come to some of these webinars just to ask questions. But what do you guys do? Like, what's your process look like?
Yeah, I when I started with Rush PT, I was the only lymphedema therapist in the clinic and then the only revital therapist in the clinic. So I had to get really creative with like trying to figure out who to ask. And what's really cool about Revital, the national program, is very, very collaborative and communicative. So I did not need to wonder who to ask questions for. I had Audrey and Elena just kind of like in my back pocket. I could just like email them or post on like I can't remember what we used before, but now it's a Viva Engage poll kind of discussion board, I guess you could call it. So that was extremely helpful. But yeah, then I kind of relied on, like NCCN guidelines or the APTA Oncology. They have, those fact sheets. That was definitely something that I relied on. But yeah, tons of patients still stump me. I mean, you can't know everything. So
Yeah, I probably have at least one a month, if not more, where I'm like, oh wow, that's not what I expected.
yeah.
Sometimes you need just one more day to evaluate. You're like, oh my God, what was the history? Like, I need another day. Like, okay, I'm going to do all these tests and measures when I see you next time. Because they have like such an extensive history. And I'm like, oh my God, where do I start? So, but yeah, we are part of the Revital Clinic, so we do have like all these resources where we can refer back to. But I'm also lucky to have my mentors on site, and they're in the same city, so I can always reach back from residency. And I'm also part of a APTA social chair. I'm also a social chair for APTA, so I do know some of the people in the section itself where I can reach out. And yeah, our website itself is a great source for information. You just start digging in, and they just revamped it not a very long ago, so it's more user friendly, and patients can have more resources out there too. I do refer some of my patients out on over there too, just to read about CARF and stuff like that.
Yeah, I am with you. That extra day, sometimes you're like, all right, I just need a little bit of time to breathe, and I'm really going to hit it hard on that next visit. And kind of building on that, so this might be a question for Dr. Sharma and then Dr. Thess, but Dr. Aspin will get back to you. So how, Dr. Sharma, how are you able to find your way into the oncology rehabilitation field? Like, I
It's
know it was
very
3 years
interesting.
ago.
Yes. So it was just very crazy. I was very sleepless. I'm like, what am I doing? Okay. And I looked at LinkedIn and I saw this. I'm like, okay, Baylor program. Because I had followed all these residency, their Instagrams and all these social media. And I saw Melissa posted there's a residency opening at DFW. I'm like, what? And we had moved just a month ago to Dallas back. I'm from Phoenix. So I'm like, oh my God, I need to reach out. When I emailed her, I'm like, hey, I'm interested in this program. And I literally thought it's a computer automated response. And I took that email and I took it, you know how people like recruiters or somewhere the spam emails? I literally thought it like that. And I took it to my husband. I'm like, do you think it's a real person? He's like, yeah. I'm like, oh my God, I think I have a chance and I'll be called for an interview. So that is how I got back, and it was like a panel discussion and all of that. I spent a day with them and absolutely loved the program. It has like all inpatient, has your vital certification integrated to it. My CLT was a part of it too. So it gave me like a comprehensive review of like whatever I needed as an evidence-based clinician, which I was looking for. Because before that, it was just like I was wondering what is happening. There were people there, and everybody was doing their own thing. Everybody was doing their different things, and I'm like, where's the consensus? Like, there should be some kind of consensus. So I think residency helped me to kind of streamline everything, especially my thoughts and how I approach the oncology patients. Yeah, so that was my way to get back to oncology rehab.
Yeah, and that's, I mean, it's kind of funny you mention it, right? Like, we always hear you can use LinkedIn. And I feel like sometimes people don't really know if that's true or not. So it's really helpful to hear that it worked out for you. And then
Yeah,
Dr.
it
Thess,
sure did.
I had a question for you because I know you get this a lot. Like, where can people look for jobs that are in the oncology world? And if, especially right now, I know there's kind of some variance in jobs, and maybe there is an interest in oncology, like what can they do right now to build their knowledge and
Mhm.
still be, maybe competitive or feel ready for a job in the future?
Yeah, absolutely. It is absolutely true about LinkedIn. I can confirm that as someone who uses LinkedIn to put job opportunities out there and search for people that may be interested in it. So that is absolutely true. Some of the other things that we're trying to do with specifically to us within Revital Select Medical when we're seeking people. Let me try to fix my fuzzy camera there really quick. Is just putting identifiers on the jobs so that, if you were to put keywords into a search, physical therapist, oncology, that should start pulling up jobs that you can see where there's that opportunity to get into oncology. Nice thing about a lot of our roles, you don't have to have experience, right? We can train it. Otherwise, honestly, some of the biggest resources, the first resources that I point people to, whether it's students that are wanting to learn more, get more involved, sources of education is honestly the APTA. Kind of circling back to the question about where, if people are looking for kind of that, where can I pick a brain? Where can I dive into the world of what's happening, asking questions. I have that patience that stump me. The listserv and being able to throw the questions out on the APTA. I'm always directing people to those resources. Otherwise, I think, like I said, following different organizations on like a LinkedIn type social media platform is a great place if you're in a certain area and that there's a certain cancer center or hospital system that you might want to be a part of. Following those systems. And honestly, I love it when people reach out to me and are like, hey, I'm interested in this. Can you tell me what's going on? And the number of times that has led to, we didn't have anything necessarily posted, but this person is interested. They could be a great addition to the team. Let's add something and bring them onto the team. The number of times that's happened is, more than I can count at this point. So I think putting yourself out there, not being afraid to find the name of someone that you can talk to and reaching out. Like I said, I love it. I love having those conversations. I love hearing what really draws people to oncology positions. I love hearing people's passion. And then I think getting to be able to have a small part in connecting people to the opportunities that they're passionate about. I think that's part of what kind of fuels the similar feeling that I got from being able to help patients. So all of that to say, don't be afraid to reach out and put yourself out there and ask for a conversation, because I personally love to have them. And a lot of times it ends up turning into opportunities, if not right at that moment, then down the road. I remember those people. And if I kind of keep my eye out for the perfect opportunity. And when those come up, then, those are the first people I'm calling.
Yeah, it's so funny because I think everyone has heard that the PT world is really small, and it feels like the oncology PT world is like even smaller,
Yes.
in a very beautiful way. I
Yep.
love, quick plug, going to CSM to meet everybody is so fun.
Yes.
That's how we actually connected, which is amazing.
Yeah.
But yeah, and that's why we're having these webinars, and we're just trying to start these new special interest groups, because the interest in oncology is actually growing so quickly, and the effort to grow oncology in the curriculum is also growing. So I just feel like the more survivors we have, as we know, the more they're going to be an outpatient, certainly an inpatient. So yeah, I think it's great that we have all these questions with regards to how to get the job. I think it's just the direction of how to get there is sometimes what people need a little bit of help with. I have a question for all of you. I know we talked about lymphedema and things, but I will ask each of you this question, which might help with the next question, is that if you could go back and tell yourself something on the first day of your job, what would it be?
A really good one.
I know.
That's good. I think I would just tell myself, like, just just go for it. Don't hesitate. I think coming in, so I was hired for lymphedema, so I got the certification before I even started, and I was expected to kind of start seeing lymphedema like right away, and I was the only therapist, and my manager was like, I don't know how lymphedema is treated. Like, you have the certification, figure it out. And I was like, day 6. I'm like, okay. And I was gonna mess up anyways. It was not gonna be perfect, and I wish I could have just kind of gone for it a little bit more. I think I was a bit more hesitant, which then it's really hard to build that rapport with patients, especially with something so like debilitating and vulnerable. I think I wish I could have just been like, yeah, like I know, I have the certification, I know exactly how to treat it. So I think, yeah, and like don't be afraid to make mistakes, because I think that's where you learn the most.
I totally agree with what Sophia said. It's like I was so scared. Oh my God. I was like, how do I do this? Like, am I the right person? Like me? I'm gonna do all this. But yes, oncology rehab professionals are amazing. Like I know other sections are awesome, but there is something with this group. This is amazing. Everybody is so open and nice. I still remember when I attended one of the meetings for oncology section, and I'm like, oh my God, these people are so nice. So even if you don't know something, just go talk to them. They're just, everybody's so nice. I wish I could tell myself, I'm like, it's okay to make mistakes and be afraid. That's how everybody learns. And I didn't know at that time, but that's what I would tell myself too, for sure.
So I think I'll answer that from the perspective of when I first started into lymphedema. And, I may or may not have had my training manual hiding under the plinth, the 10 a.m. Monday morning eval I had after coming back from my weekend lymphedema training. So anyway, I think I had no idea what that would be the start of, right? I thought it was going to be, it seemed like something cool. I liked the idea of being able to build and grow something. I had no idea that that would have been the catalyst for really incredible trajectory to my career. So I think, and I enjoyed it. I appreciated it. I think in hindsight, I would tell myself, like, you're going to get to do some really big, incredible things because of this choice that you made. So enjoy every single step along the way and appreciate what you're getting to be a part of. Because I had no idea, I didn't have that viewpoint at the time, right? So I think that's what I would tell myself all those years ago that
Yeah,
will remain numberless.
yeah, I mean, numberless is all good. Yeah, I feel like I'm 5 years in now, and it's like maybe the first time I actually sometimes feel like I know what I'm doing. And I was like, wow, I remember graduating, and my mentor at the time, she has been practicing for a numberless amount of times, totally respect. And she's like, your first year, you're gonna just really focus on not hurting anybody. And I was like, I'm going to be better than that. I mean, come on, in my first year. But I look back and I laugh, like that's probably pretty true. I'm in the inpatient setting, so safety is definitely key. But I feel you, making mistakes is totally normal. And I'm sure all of us can remember some patients where you're like, wow, I can't believe I did that. But in terms of, maybe you pushed a patient a little too much, or you tried an exercise and you're like, I don't know what I was doing there, but that's fine. um and then kind of building on top of that, so I know all of you have your CLT, which is awesome. Even with the CLT or beyond, do you guys have any continued education courses or classes in general that you recommend for people just to learn a little bit more about skills, or learn a little bit more about the diagnoses that they're experiencing in the inpatient and outpatient setting? Anyone can answer that one.
Yeah, I say I'll kind of jump in on that one from the where I direct people that I'm talking to, especially, students, early career professionals that are kind of like, where can I learn more? APTA's courses and PORI, phenomenal courses that are available to all. Obviously I would love to say, everybody please come to Revital. You can have all of the access to our courses. And I know that's not realistic and feasible. But yeah, so APTA's courses and then PORI are definitely my two main go-tos.
I can't speak to it directly because again, Revital, they have so many education and stuff, but the biggest switch that I saw when I switched jobs was I started at like a really small peds company. So continuing education was not super accessible to me because the company just didn't really have enough resources to make it financially easier. So that was like something that I really looked for in my next job was, a larger company that placed an emphasis on education, placed an emphasis on supporting your interests. I like remember My manager like emailed me back after my application. She was like, this is like all outpatient ortho, like, because all of my history was like peds. And I was like, yes, because like this is what I need. I need a bigger company that can support all my interests. So that might not be so direct to your question, but I think that's some advice I would give is definitely look for something that promotes education and promotes, developing your interests because that's honestly what brought me to Revital, like indirectly.
Yeah, I think in addition to Pori courses, which I've taken a couple of those are amazing. And within the Vital program, we do have like periodically, the last course that I attended was super awesome because sometimes we discharge our patients and they're like, and this was like return to work. So we had a very recent one. It's like preparing patients for return to work, which is, I'm like, okay, we were getting ready for discharge. So we have like tons of resources out there. If you can't find anyone who, what interests you, find a mentor. Just talk to anybody. Random emails. Yeah, you don't know what's coming your way.
Dr.
You'll be
Sharma,
surprised.
random emails, those can hold a lot of power. So I respect that. And I'll kind of have a question for Dr. Aspin, then a question for Dr. Sharma. So for Dr. Aspin, it sounds like you went through the Revital program, but you didn't do a residency. Is that correct?
Yeah, yeah. So
Okay.
I knew residencies were an option. They just weren't really an option for me. Like I had just moved. It was the pandemic. It was like there was just like a lot of stuff kind of just like way up in the air. So, and even by when I was ready to switch jobs in 2022, I still felt like the pandemic and everything was just really kind of just not, wasn't where it was. So yeah, so the residency wasn't really an option for me. So when I learned about Revital, that was kind of like my big segue into cancer rehab, which initially my foot in the door was the lymphedema therapist job that was posted. And I was like, oh, cool. And yeah, I did not know what was coming for me, which is great because I love it anyways. But yeah.
Okay. And then Dr. Sharma, I know you did residency. Um, do you feel like, I mean, you can be honest or not honest, but did you feel like the residency helped you? It sounds like it did streamline your thought processing and all of that. But can you kind of speak to why you found residency to be helpful? And I know the random email helped for you and LinkedIn, but why did you decide to go do the residency route in general?
I do better with a formal training. So it just depends on how you want to learn. I was done trying hitting an error and everybody was had their own opinions and experiences with how they have been seeing patients. I'm like, I want to be in a formal training where because I wanted to do board certification for oncology. So I'm like, this is the greatest way, in my opinion, to at least prepare. People do by themselves, and I have huge respect. I don't know how to do it because I got all the mentorship and direction. So it was like, okay, I know these questions. Okay, I have even my mentors have quizzed me on those, or I've seen those questions in my mentorship exams. So it was just a very nice way for me to be formally into a program and just upscale my career.
Yeah, got it. I have been having, I don't know if you guys have been having this as well. I've been having a lot more people approach me, not only students, but new professionals as well, with regards to should I do residency? Should I not? And I always say it depends. I know that's
Yeah.
everyone's favorite answer. But I think it depends on the type of learner you are. I think it depends on the needs, Dr. Aspin, like with what you were saying. So for myself personally, I had no interest in residency, but I practiced for 2 years and had happened to come upon a new opportunity for residency and decided to do it. And I'm so glad I did it. But that definitely wasn't in the cards for me initially. So it seems as all of us have had this experience of kind of falling into the right things and not really knowing where it'll take us, but all to show that, we all kind of end up here in the same place. So that's awesome to hear. I just was curious if each of you had, I know we talked about advice for ourselves, but do you have some advice for students who are interested in oncology or new professionals just in general? And I know, just for some context, I've had actually a lot more therapists at CSM approach me who are in rural areas who are also gaining a lot more interest in oncology. So I basically today it sounds like, send that email, push yourself, don't be afraid to make mistakes. But if you have any other advice, I'd love to hear it.
Yeah, I think in those rural settings, but just also anywhere, I think finding an oncology doctor, whether you're really interested in breast cancer, prostate cancer, whatever or if it's all of it, that's great. But I think finding one and, really pitching to them like, hey, I want to treat this population. And here, I've seen this population before, I know how to treat XYZ, loss of range of motion from radiation or radiation fibrosis or any of that. And going from there is probably what I would say.
I would say just follow whichever place you're interested in, follow them on their social media and just try to email them and reach out and see maybe someone out there will respond your email. And if you have any questions, you don't know how to get into cancer rehab, there's tons of resources. And that is why we are at our academy too. We're trying to help out the new individuals and new the students who are trying to get into cancer rehab. It's like, but there's tons of resource. Please do not hesitate to reach out. It's okay to push yourself out there. There's nobody there to judge you. There's tons of people. They're just there. They'll happily hug you and bring you here in this section. It's just, I call it's a coolest group to be in.
I say, and I'll build on that, Akanksha. I'd call us a tiny but mighty group because we are that even smaller group within the small world of PT, and but holy cow, we are a mighty, mighty bunch in oncology rehab. So, I think for anybody, whether it's new professionals, people in rural areas that have the interest that maybe don't have as much access, try to immerse yourself in the field as much as possible, in the resources like the APTA, the points that people have made about connecting with other physical, other therapist providers, referral source providers, that type of thing. And then I think making sure that, like, let's say you've now found the opportunity, the job opportunity that you want to try to go after, highlight that on your resume and really lean in and make it stand out that you have those experiences, because that's going to draw my eye. And I'm going to want to hear more about that. Definitely something that I'm looking for. So I think getting the exposure, and then, like I said, finding ways to highlight it on the resume however you can when you do, or if somebody does decide to go after a certain job. Because at least from my perspective, I'm taking note of it, and that's gonna make me even more curious and want to learn more. So
Yeah, all of that is such great advice. I feel like over the year, like kind of with what we've been talking about today. So pushing yourself to meet the doctors. I don't know if you feel this way, Dr. Aspin, like that feels a little vulnerable. I do it.
Super awkward.
Yeah.
It's never comfortable for me. And no, and that's part of my role now here at Rush PT in Chicago, and I have to push myself to do it every day. And it's okay. It's okay when you're in that situation, because you very quickly learn doctors are also just people.
Yes, 100%. As part of my residency, we had to do MD shadowing, which was awesome. If anyone has a chance in residency to do that, like, do it. You get to educate patients on physical therapy, but you also get to learn so much about surgeries and how clinics operate. But yeah, you just feel real vulnerable being like, I actually can help with that. And you shouldn't feel vulnerable saying that, but that's often what happens. I don't know. That's how I feel.
Yeah. It's
Do
not
you feel that
easy.
way?
It's really not easy, but like the thing I have to like remind myself, and I'll remind you guys, is no one is going to outright say to your face, no, I don't want to talk to you. So, they're not going to say that. So as long as you can kind of go in and put that like mask of confidence on, people will hear you out. And I've had some of like my best conversations with providers when I just kind of surprise them. Like I just kind of stop in. I do not give them any warning. I don't send them an email. I'm just there. And then we have like really good conversations.
Yeah, some of really great referrals have come from doing that. And Dr. Sharma, your random emails have really inspired me because there is just so much, even with attendings or even with doctors, right? Like random emails can hold so much power. But I cannot emphasize enough how whenever I get a random email, I am so pleasantly surprised. It's never a bother, kind of similar to like the doctor thing. Like I'm never bothered when someone sends me a random email. So anyone here, you can certainly send me a random email. I am open to it. And yeah, just to your point, Dr. Thess, like resume building is also kind of vulnerable. Do you find that to be true or not true? Because I feel like sometimes for myself, I don't know what to put on the resume. Like I'm just not sure what is important.
Yeah, no, that's an interesting choice of words. I've never thought of it that way, and it's so true to use the word vulnerable. It's also been really eye-opening to me, and I think some of this is just, I feel like as a profession, we tend to be very humble. And so sometimes doing your resume can feel like you're bragging on yourself. And that's just an odd space. I know, at least speaking for myself. Um, and I can't stress enough, now being on the other side of things, the person who's looking at resumes and, looking at qualifications and, does this person meet the minimum qualifications? I would love to talk to them. Can I? That type of thing. Highlight it, put it on there, brag on yourself. Obviously in an efficient and effective way, because we're looking at different resumes and looking to pick up different things, just kind of how we read as humans anyway. But yeah, and it's changed over the years as well, the kind of the resume tips that are out there. And I feel like it's changing really rapidly compared to that, numberless amount of years that, I first got into putting resumes out there and trying to get jobs in PT. So, but yeah, I think the biggest thing is, again, going back to highlight the oncology experience, the oncology exposure, even if it's you took these courses in oncology. I see that. I'm looking for that. So while it may not necessarily seem relevant, it is, especially if you're wanting to get into the world of oncology. So, and again, like, reach out to people that are out there to help. I'm always happy to talk to people about resume tips, interview tips. So I would love any random emails from people that want to talk about that kind of stuff as well. But yeah, I guess it's one of the nice things about socials as well. There's a lot of tips and tricks out there. I think the biggest thing that I would say, if you have the experience, put it on there. So I think that's the biggest mistake I see people make, is not putting those pieces on there. And sometimes it ends up leading to like, I can't technically qualify that to even have the conversation with the individual because a minimum qualification isn't met. So yeah, put it on there. And be willing to be vulnerable and brag on yourself.
Oh my gosh, so true. The PTs are so humble. And we're all so amazing. So we should probably brag a little bit more.
100%.
That's also a lesson for
100%.
today. Yeah, I feel like a big piece of advice, and I don't know if you guys have this as well, is like, I just always tell people a job or a residency is as much of a fit for them as it is for you as well. So making sure that you're really researching the job, what you hold as values with regards to like vacation time or continued education or mentorship. Like those are all things that you can look for in a job or in a residency. Or even, you know, when you're sending those random emails and looking for different experiences, just trying to find things that align with what you value as well, but also making sure that you're staying true to yourself. Because I think sometimes some of us probably jump at jobs where we're not totally sure. You know, some of us have done jobs where we're like, wow, I really thought that was going to work out. And maybe it just wasn't quite the right fit. So I want to open the floor for some questions. I want to say thank you so much to you guys. You guys have answered these questions and have been very helpful and have inspired me today. So I thank you for that. So I just want to say my thank you. Are there any questions out there? I didn't see anything in the chat, but I just wanted to open it to anyone out there who has any questions for our lovely guests today.
I will add, Lauren, I was going to throw it in the chat. Going back to the resources and like learning opportunities, I believe close training, they are, you know, one of the lymphedema certification courses. I believe they also, and I think Norton does as well, have some like smaller couple day courses within the realm of cancer rehab that I don't believe you have to be a CLT to access, that are also phenomenal. So like Jody Winnicor does an amazing breast cancer rehab course for close training that I'm almost certain you can access that. So just wanted to throw out there another, you know, available to all resource for education.
Sorry, one more time. You said, what were the name of the courses?
The organization is Close Training. It's KLOSE. And there's a couple different, like, I know there's a breast cancer rehabilitation course. They're the ones that offer the Strength After Breast Cancer course for that evidence-based multimodal exercise program for reducing onset and exacerbation of lymphedema in those at risk. But yeah, and I think Norton might have a head and neck cancer course. So some of your lymphedema training organizations that offer that CLT pathway are also going to offer more of your traditional, you know, 4 to 12-hour courses as well that are available to all.
Awesome. Thank you, Dr. Sharma, for dropping that, because that's an awesome, I might do that. That's awesome. And then just if no one has questions, I just wanted to share that. So just for a reminder, this will be recorded. So we will either upload this to YouTube. We'll also have this available via our website. Just some tips and tricks from today. Dr. Aspin and Dr. Sharma, you can certainly add in. Send that email. Definitely follow socials. We have the APTA Oncology SNP Special Interest Group Instagram, where we post a lot. So you certainly can start there. I know some people still use Twitter, so you definitely can go there. And then we have all these amazing people here who I'm sure are happy to talk to you at a different time as needed. So if you guys could drop your emails in the chat, that would be very appreciated. But thank you so much for being here. I know it's a little bit late on the East Coast side, and I hope you guys stay safe, but just a huge thank you for being here today. I feel like I've learned so much from you guys.
Thanks for having us. It was fun.
The random emails are so good. I love that.
They're the best. They really
absolutely work.
Yes, they work. I mean, I am always shocked. I always feel like such a bother. And then all these amazing people that I meet through them continue to just surprise me. So yeah, awesome. Well, everyone, thank you so much for being here today. I hope I get to see all of you again, or some of you at some different point. But if you guys have questions, you can email our amazing guests. I'll also drop my email in the chat in case anyone ever needs it. But thank you, everybody.
All right. Thanks for having us. Have a good night.
Have a good night, everyone.